In this video, we will discuss sexually transmitted pathogens and infections. Sexually transmitted pathogens include bacteria, viruses, and parasites. These pathogens are usually transmitted by direct contact via sexual activity, but some of them can be transmitted indirectly via fomites. Common characteristics of sexually transmitted pathogens may include genital ulcers, urethritis, vaginitis, and cervicitis, but some may produce an asymptomatic infection. These pathogens will enter the body via the genitourinary tract and produce either a localized or disseminated infection. It is important to note that regardless of the mechanism, disease caused by sexually transmitted pathogens is most often the result of the host inflammatory response. Let's start by looking at bacteria that establish localized infections. The most common sexually transmitted infection in the U.S. in terms of case per year are chlamydia and gonorrhea. Clinical presentations of chlamydia in women include cervicitis and urethritis, while men present urethritis and potentially epididymitis. Clinical presentations of gonorrhea in men include epididymitis and urethritis, while most women are asymptomatic with some presenting cervicitis. Both infections are treatable with antibiotics, but no vaccines are available yet. Next, let's look at viruses that follow the localized infection mechanism. First, we have the herpes simplex viruses that are categorized into type 1 and type 2. Type 1 is associated with oral herpes and cold sores, and type 2 is associated with genital herpes. It is important to clarify that there is nothing biologically distinct about these two types of viruses, and either type can cause an infection at either side of the body. There is no cure, but antiviral medications can help suppress symptoms. Other viruses in this category include human papillomaviruses, which cause genital warts and may progress into cervical cancer. There is no pathogen-specific treatment for people already infected, but 3 vaccines are available against 4 serotypes of papillomaviruses that are most commonly associated with cervical cancer. And lastly, let's look at a parasite that follows a localized infection mechanism. The parasite Trichomonas vaginalis causes the disease trichomoniasis. Clinical presentations in women include vaginitis, while both men and women can present urethritis. This infection can be treated with the antiparasitic drug metronidazole. Now let's move on to pathogens that follow the disseminated infection mechanism, starting with the bacteria Treponema pallidum that causes syphilis. The infection starts as a localized primary syphilis, but if left untreated, it will disseminate and ultimately progress into tertiary syphilis, which can affect almost any organ in the body. Fortunately, this infection can be treated at any stage with antibiotics. And finally, let's look at viruses that follow a disseminated infection mechanism. First is the hepatitis B virus, which causes a hepatitis B infection. In most cases, the immune system can fight off an acute infection, but it is possible for the infection to progress into chronic disease. A vaccine is available, but no pathogen-specific treatment is 100% effective. Second is the human immunodeficiency virus, better known as HIV. If left untreated, HIV begins as a subtle immune deficiency, but progresses enough to be defined as acquired immune deficiency syndrome, also known as AIDS. There is no cure or vaccine available for either infection, but highly active antiretroviral therapy is available to suppress HIV replication and prevent the progression of AIDS. Thank you for watching, and I hope you learned something new.